Welcome to the special edition of Neurology News Network. I'm Marco Meglio. Please excuse our appearance this week as a majority of the U.S. workforce, including the Neurology Live team, moves to working remote as we come together to help reduce the spread of the novel coronavirus. This week's episode is centered around the recently concluded American Academy of Neurology annual meeting. First up, research using a retrospective epilepsy database revealed that cerebrovascular disease is a common cause of seizures, most notably in the middle cerebral artery or MCA territory. Among this database, levetiracetam was the most commonly used anti-seizure medication. Sidger Salim and colleagues aimed to identify the prevalence of post-stroke seizures and the role of various anti-seizure medications in the management of post-stroke seizures using a cohort of 2,721 patients from the database. Among these patients, cerebrovascular disease was found to be a common cause of seizures, occurring in 6.61% of patients with a mean age of 62 years and a median age of seizure onset of 54 years. Late onset seizures were more common, occurring in 89.4% of patients compared to 10.55% of those with early onset seizures. The types of stroke varied, with 77.22% of patients experiencing ischemic stroke, while 18.8% had hemorrhagic stroke and 3.3% reported with ischemic with hemorrhagic transformation. Next up, 2-year data from the open-label extension of the Momentum trial showed that inebilizumab, an FDA-approved treatment for neuromyelitis optica spectrum disorder, or NMOSD, continued to provide benefits similar to those seen in a randomized controlled period. In total, 216 of the 230 participants initially randomized and dosed opted to enter the open-label extension, where they received inebilizumab 300 milligrams every 28 weeks for at least 2 years. In both the randomized controlled period and the open-label extension, 87.7% of patients receiving inebilizumab remained attack-free. However, those in the open-label extension remained attack-free for up to 4 years. In comparison, 60.7% and 83.4% of those on placebo remained attack-free in the randomized controlled period and open-label extension, respectively. At open-label extension baseline, mean EDDS scores were lower in the group randomized to inebilizumab compared to those in the placebo group. By open-label extension week 78, patients randomized to either group demonstrated lower EDSS scores recorded at baseline. Lastly, data from a pair of studies revealed that treatment with fremanezumab is similarly effective in patients with higher frequency episodic migraine and moderate frequency episodic migraine, as well as safe for patients with a previous history of cardiovascular risk. The data included in both abstracts were from 2 double-blind phase 3 trials which randomized patients 1:1 to quarterly fremanezumab, monthly fremanezumab, or placebo for 12 weeks. The first included 1,174 patients with episodic migraine, 659 of which had moderate and 515 of which had higher frequency at baseline. From baseline, least square mean reductions in monthly migraine days were significantly greater with fremanezumab versus placebo group in the moderate and high frequency group, indicating similar therapeutic gains. For more direct access to expert insight, as well as the top stories from AAN 2021, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.